What I want to walk you through today is a really powerful case study in strategic philanthropy. It's the story of how a relatively small, well-timed grant in Ghana helped turn a genuine crisis into a huge opportunity for national policy. So, at the center of all this is our partnership with Results for Development, or R4D, as you'll hear me call them. This briefing is all about the incredible impact of a short term bridge grant we provided to their team in Ghana, a grant that honestly punched way above its weight and delivered returns we couldn't have imagined. Okay, so here's how we're going to break it down. First, we'll look at the crisis that set the whole stage. Then, our specific intervention, what we actually did. Third, we'll talk about the political shift that just changed everything. After that, we'll dive into the amazing return on that investment. And finally, we'll pull out the key lessons for our work going forward. Right. Let's set the scene. You have to go back to early 2025. Ghana had been making really significant progress toward providing healthcare for all its citizens. But all of that was suddenly in real jeopardy. So what happened? Well, the trigger was an abrupt stop to funding from USAID. Now, this wasn't just some line item in a budget. This cut off vital, on-the-ground technical support for a new and really important preventative health initiative. All of a sudden, years of foundational work were on the line, and this critical gap in expertise and momentum just appeared, seemingly out of nowhere. And that's where we came in. But it's really important to see our role here not as some kind of big rescue mission. Nope. This was a very deliberate, surgical intervention that was designed to do one thing: bridge that critical gap. So the number was $130,000. This wasn't about funding a whole new program for years. It was a very precise 4-month investment, and the goal was crystal clear: keep the expert R4D team on the ground and just preserve the crucial momentum they had already built. So what did this targeted funding actually let them do? Well, it did a few critical things. It meant R4D could keep their expert team together. It gave them the breathing room to finish up a really important cost analysis for that new health package and to properly assess a new primary care delivery model. And maybe most importantly, it bought them just enough time to go out and secure stable, long-term funding. Okay, now this is where the story gets really interesting. An unexpected political development completely transformed the landscape, and it basically flipped the script, turning this crisis we were trying to manage into this incredible opportunity. You can see just how fast things moved here. The USAID funding gets cut in January, our bridge grant lands just weeks later in February, and then, right as our grant is stabilizing the situation, a new president takes office and announces this bold new health mandate in March. Talk about being in the right place at the right time. And this was the mandate: a powerful commitment to achieve universal, free primary health care for every single citizen. I mean, think about that. That single statement opened up this massive policy window, a moment where big systemic change wasn't just possible, it was now the central goal of the entire government. And this, right here, is the absolute key. If it weren't for our grant, that R4D team, they would have packed up and gone home. But because they were still on the ground, they were perfectly positioned. They had just completed the exact cost analysis and modeling the new government needed to turn that bold vision into an actual workable plan. They were ready to go from day one. Okay, so this gets us to the heart of the matter: the real, tangible return on our strategic investment. And this goes way beyond just keeping a program alive. It's about the incredible ripple effect our funding had. Let's start with the money because the numbers are pretty staggering. Our $130,000 investment acted as a catalyst, and it directly helped unlock $1.5 million in long-term funding from major partners. That's more than a tenfold return on our money, and it made sure that that critical technical support could continue for the long haul. But honestly, the financial return is only part of the story. The impact on policy, that's where things get really exciting. The work our grant kept alive literally became the bedrock of Ghana's new national health policy. R4D's cost analysis, that was the financial blueprint. Their model for primary healthcare networks, a smart way to link up local clinics for better care, was adopted as the national standard. And their research even led to bringing private pharmacies into the plan, which massively expands access to care. And the assessment we funded, it basically proved this new model worked. It didn't just find that patient referrals between clinics were getting better. We saw strong buy-in from the community. People were literally contributing their own resources to help improve their local health centers. This was exactly the kind of data needed to justify taking the model nationwide. Now, we have to be realistic here. The work is far from over.
The assessment was also very clear-eyed about the challenges that still exist, things like securing sustainable long-term financing, dealing with staffing shortages, and tackling poor infrastructure in some of the more remote areas. Being honest about these hurdles is absolutely essential if this program is going to succeed in the long run.
So, what are the big takeaways for us? What have we learned from this? Because this case really does provide some powerful lessons that should shape our future strategy. Look, this isn't just a feel good story from the past. It matters right now, today. Ghana has this unique window of political momentum to really drive this change home. This whole project is a perfect textbook example of how to manage a donor transition effectively. And the stakes couldn't be higher. These policies have the potential to save thousands of lives and could make Ghana a global model for how to do primary care right.
And that really brings us to the big question for all of us in this room. This experience shows the immense power of small, strategic, timely grants to bridge a gap and catalyze massive system-wide change. So the question for us now is, how do we get better at spotting these moments and replicate this catalytic funding model to seize other high-leverage opportunities just like it, wherever they may be?